Prenatal nutrition and food allergy. For a healthy baby, it is essential that the mother during pregnancy has a healthy and a balanced diet. Providing adequate nutrition and the essential nutrition to the mother will lead to a birth of a healthy child. Balanced nutrition during the prenatal and the postnatal periods is important to prevent many genetic disorders. An idea and knowledge about the food allergies and common food allergies is essential to prevent the food allergies in children as well. Factors that affect the fetal development are poor nutrition, alcohol usage, smoking, use of over-the-counter medication, exposure to various agents like X-rays, and also certain illnesses like AIDS, German measles, syphilis, cholera, etc. Importance of prenatal nutrition. Prenatal nutrition is extremely important to provide energy and to overcome the pregnancy related issues, to maintain the healthy weight of the newborn, to maintain the healthy weight during the pregnancy and reduce lot of various birth defects. Role of prenatal nutrition in preventing various genetic disorders. Many genetic disorders are preventable by the use of a balanced prenatal and intranatal nutrition. For example, Down syndrome, which is a very common genetic disorder which is supposed to be because of the trisomy 21, that is an extra chromosome at the 21st level. As per the recent studies, it is seen that the mothers of children with Down syndrome, they have an imbalance in the folate metabolism. So, prenatally, if they are given an adequate amount of folate and the folic acid, the Down syndrome can be prevented. Another condition where the Down syndrome is related to the nutrition is the deficiency of zinc. An adequate amount of zinc can or is observed to prevent the Down syndrome. Mitral valve prolapse. Another commonly seen condition is the mitral valve prolapse, which is an inherited connective tissue disorder. In this condition, there is a disorder with the connective tissue, that is the collagen inheritance, and this is similar to the Marfan syndrome. Now, as per the nutrition oriented studies, the people with magnesium deficiencies are prone to the mitral valve prolapse, and the supplementation of magnesium may elevate or suppress their symptoms. Wilson's disease. The people who have inherited the Wilson's disease are supposed to have excessive copper in their body. Zinc supplementation therapy can help in reducing the amount of copper in their body and thereby treating the Wilson's disease. Blue sclera. This is a condition which is again linked to the connective tissue disorders. It is seen in osteogenesis imperfecta and Marfan syndrome, and it is most commonly linked to the iron deficiency. Cleft palate. Cleft palate can to a very large extent be reduced by the supplementation of mothers with folic acid. Prenatal supplementation of mothers with multivitamins and folic acid can reduce spina bifida. Cerebral palsy. Recent studies show that when the mothers of lower birth weight babies are supplemented with magnesium sulfate, show a lower incidence of cerebral palsy. These findings come from a study sponsored by the National Institute of Neurological Disorders and Stroke. Prevention of allergies. There are some certain points which have to be kept in mind to prevent certain allergies. Do not eat peanuts during pregnancy. Try to breastfeed the child for at least 6 months. Do not eat peanuts during breastfeeding. Wait to start solid food. Delay the food causing allergy. Then give the food to the child one at a time and introduce the food gradually. Also, always give child the cooked and homogenized foods. Importance of prenatal nutrition. Having a thorough knowledge of the prenatal nutrition is extremely important because it reduces the effect of the genetic disorders. It also helps in understanding the importance of balanced nutrition for a pregnant woman. Healthy eating is extremely important for both the pregnant mothers and for their healthy babies. Maternal age. If a woman gives birth at an advanced age, that is the age which is beyond 35 years or older, it is considered as the advanced maternal age irrespective of whether the childbirth is first or not. Fetal chromosomal abnormalities. These are supposed to be very common in the advanced maternal age, that is, as I have already mentioned, 35 years or older. Now, this is caused due to a phenomenon called as a non-disjunction, which occurs during the process of meiosis during maternal oogenesis. Various chromosomal abnormalities or the fetal abnormalities have been reported which are linked to the advanced maternal age. They are trisomy 21, trisomy 18, XXX syndrome, Klinefelter syndrome, etc. In past 4 decades, the women giving birth in their late 30s has increased 4 times in India. The advanced maternal age also comes with list of various risk factors like miscarriages, stillbirth, gestational diabetes, hypertension, twins, etc. Risk for chromosomal problems. The risk for chromosomal problems increases with the maternal age. A woman under the age of 25, if she gives birth, there is 1 in 1250 chances that the child will be born with a Down syndrome. However, in case of mothers with an advanced maternal age, that is 35 or older, the chances they reduce to 1 in 100. Therefore, with advancing maternal age, the chances of having chromosomal abnormalities such as the Down syndrome increases. Risk for miscarriages. As the maternal age advances, the risk for miscarriage also increases. For almost all the women, most of the miscarriages which occur in the first trimester are due to any of the chromosomal abnormalities in the baby. Prenatal testing can help in ruling out the chromosomal or another genetic birth defects. The various types of tests may include blood test, ultrasound, chorionic villus sampling, amniocentesis, maternal drug therapy and genetic disorders. Most of the medicines are not harmful to the developing baby. However, some medicines, when they are taken by the mother unconsciously or unprescribed, it may cross the placental barrier and thereby may lead to some birth defects in the fetus. These medicines are called teratogenic. Generally, a drug or a medication may involve in various ways and cause risk to the developing fetus. They may lead to miscarriages, it may cause a premature labor, it may harm the baby's organs, it may cross the placental barrier and thereby putting the life of the baby at risk. The potential of a drug to harm the pregnancy or the baby depends on a range of factors. It depends on the type of medication taken, the size of the dose, how often the medication was taken. Was the medication taken alone or was it taken in combination with some other drugs, and the gestational age of the baby. Teratogenic drugs and medicines. As already mentioned, teratogenic medicines means the medicines which have the potential to harm the developing fetus. These are some of the common medicines are the ACE inhibitors, the alcohol, cocaine, high doses of vitamin A, some blood thinning medicines like warfarin, cancer fighting drugs, several other drugs which can interfere or cross the placental barrier and cause harm to the developing fetus.